Dear Tim and Moby, I am interested in learning more about the human body. What are joints? From Mrs. Rodriguez.
To begin with, a joint is any place where two or more bones meet. Joints are the weakest part of the skeleton. Joints are classified by a structure or by a function. The structural classification focuses on the material binding the bones together and whether or not a joint cavity is present. There are three types, known as the fibrous, the cartilaginous, and the synovial joints. The functional classification is based on the movement allowed at a joint. These also have three different types, known as the synarthrosis, the amphiarthrosis, and the diarthrosis. The synarthrosis are movable joints, the amphiarthrosis are slightly movable joints, and the diarthrosis are freely movable joints. Moreover, as we talked about the three different types of structural classifications known as the fibrous, cartilaginous, and synovial joints, fibrous joints are immovable joints. Fibrous joints are when bones are joined by fibrous tissue and no joint cavity is present. There are three different types of fibrous joints known as the sutures, syndesmosis, and gomphosis. Here in this image are three different types of fibrous joints. The first one are sutures, the second one are syndesmosis, and the third one is gomphosis. The first one is sutures. Sutures occurs only between bones of the skull. Syndesmosis is the second one, which is known as the bones that are connected exclusively by ligaments, cords, and bands of fibrous tissue. The third one is known as gomphosis, which is a peg and socket fibrous joint.
Moving forward, we have the cartilaginous joints. These articulating bones are united by cartilage. They lack a joint cavity, which causes them to not be so movable. A plate of hyaline cartilage unites the bones at a synchondrosis. An example of synchondrosis is the immovable joint between the costal cartilage of the first rib and the manubrium of the sternum. In symphysis, the articular surfaces of the bones are covered with hyaline cartilage. Fibrocartilage is the main connecting material. Now moving on to synovial joints. Synovial joints are the articulating bones that are separated by a fluid containing joint cavity. Synovial joints have 6 features. These include articular cartilage, joint cavity, articular capsule, synovial fluid, reinforcing ligaments, nerves, and blood vessels.
These durable, mobile joints require a substance that is strong, non-toxic, and resistant to the coercive effects of organic acids in the human blood. Today, the metal parts of the prostheses are made out of strong cobalt and titanium alloys. Joint replacements are now available for many other joints, including fingers, elbows, and shoulders. Currently, the number of knee replacements equals the same high number of hip replacements in the U.S. Most joint operations are done to reduce pain or to restore about 80% of the original joint function. Now there's a problem. With scientists, prostheses work loosen over time, so researchers have had to find a way to enhance the fit between the implant and the bone. Two possible solutions included strengthening the cement that binds the two and using a robotic surgeon called RoboDoc to drill a better fitting hole for the femoral prostheses in hip surgeries. Joint replacements are still very new to scientists and researchers and is still up and coming. Scientists still have a lot to know. We are going to discuss kinds of synovial joints in the body. Number 1 is the plane joint. The articular surfaces are essentially flat and they only allow for short, non-axial gliding movements. Prime examples are your intercarpal and intertarsal joints in your hands and feet. Number 2 is the hinge joint. The cylinder end of one bone conforms to a trough-shaped surface of another. A prime example is the bending and straightening of the elbow. Number 3 is the pivot joint. A rounded end of one bone conforms to a sleeve or ring composed of bones of another. An example is the joint between the atlas and dens of the axis bone, which allow you to move your head from side to side, indicating no. Number 4 is the condyloid joint. The overall articular surface of one bone fits it to a complementary depression in another. Another example of this is the wrist and knuckle joints in your hands. Number 5 is the saddle joints. They greatly resemble condyloid joints, but they allow for a greater freedom of movement. The articular surface has both concave and convex areas that is shaped like a saddle. An example would be the carpometacarpal joint of the thumbs. And finally, number 6 is the ball and socket joint. The spiral or hemispherical head of the bone articulates with the cup-like socket of another. An example of the ball and socket joints would be your shoulder and hip joints.
In the body, there are 5 main joints, such as the knee, the shoulder, the elbow, the hip, and the jaw. This is the knee joint. The knee joint is one of the most complex joints in the body. It consists of 3 joints all in one. The intermediate one between the patella and the lower end of the femur, the lateral and medial joint between the femoral condyles above the C-shaped menisci. The tibiofemoral joint acts primarily as a hinge, permitting flexion and tension. The knee joint cavity is only partially enclosed by a capsule. Anteriorly, where the capsule is absent, 3 broad ligaments run from the patella to the tibia. The ligaments, capsular and extracapsular, act to prevent hyperextension of the knee and are stretched when the knee is extended. Although these ligaments are in the capsule, they are outside the synovial cavity. Of all the joints in the body, the knee is the most susceptible to sports injuries because of the high reliance on non-articular factors for ability and the fact that they carry the body's weight. This is the shoulder or the glenohumeral joint. The joint is a ball and socket joint, which is when the large hemispherical head of the humerus fits into the small, shallow glenoid cavity of the scapula. The glenoid cavity is deepened by a rim of fibrocartilage, the glenoid labrum. This contributes to joint stability. The articular capsule is very thin and loose, making the joint cavity very free to move. The ligaments that do reinforce the shoulder are primarily on its anterior aspect. The coracohumeral ligament is a very strong, thickening capsule that helps support the weight of the upper limb. The glenohumeral ligaments strengthen the front of the capsule, but are weak and may not be present all the time. Muscle tendons that cross the shoulder joint contribute to the joint stability. The tendon of the long head of the biceps brachiomuscle of the arm serves as a superstabilizer and actually secures the head of the humerus against the glenoid cavity. The rotator cuff is formed by 4 other tendons circling the shoulder joint, and it blends in with the articular capsule. The muscles include subscapularis, supraspinatus, infraspinatus, and teres minor. This is the elbow joint. Within the joint, the close gripping of the trochlea by ulna's trochlear notch forms the hinge that stabilizes the joint. The articular capsule is thin, allowing for substantial freedom for the elbow flexion and extension. 2 strong capsular ligaments keep the elbow from making side-to-side movements. These ligaments are the ulnar collateral ligament, the radiocollateral ligament, biceps and triceps across the elbow joint, providing security. This is the hip or coxal joint. It is a ball and socket joint, and it is formed by the articulation of the spherical head of the femur with the deeply cupped acetabulum of the hip bone. The depth of the acetabulum is enhanced by the acetabular labrum, a circular rim of fibrocartilage. The iliofemoral, pubofemoral, and ischiofemoral ligaments are all strong ligaments that reinforce the capsule. These ligaments screw the femur head into the acetabulum, providing more stability. The ligament of the head of the femur is known as the ligamentum teres. It is a flat intracapsular band running from the femur head to the lower lip of the acetabulum. Its mechanical function is unclear, but it contains an artery supplying the head of the femur. Any damage to this artery could lead to severe arthritis of the hip joint. This is a temporomandibular joint, or the jaw joint. The mandibular condyle articulates the inferior surface of the squamous temporal bone. 2 kinds of movements that happen in the jaw are hinge-like movements of depressing and elevating the mandible, while opening and closing the mouth. The superior disc also glides along the mandibular condyle when the mouth is wide open. The mandible moves side-to-side movements called lateral excursions. This joint is the most easily dislocated in the body.
Now into diseases and injuries. In injuries, there are many types of injuries, including bursitis, tendonitis, cartilage tear, sprains, and dislocation. Dislocation occurs when bones are forced out of alignment. It is typically accompanied by sprain, inflammation, and difficulty moving in the joints. Now, sprains are when a ligament is twisted in the ankle, wrist, or other joints. The twisting of the ligament is so violent that it causes pain and swelling, but not dislocation. Cartilage tears are common types of joint injuries too, practically in sports. It is most frequently affected the cartilage in the knees. Tendonitis is an inflammation of tendons typically caused by overuse, and bursitis is an inflammation of a bursa and is usually caused by a blow or friction. Now into diseases. Arthritis describes many different types of inflammatory or degenerative diseases that damage the joints. To add on, arthritis is the most widespread crippling disease in the United States. Although there are many different types of arthritis, they all consist of the same symptoms: pain, swelling, and stiffness of the joints. However, there are more serious versions of arthritis like osteoarthritis, rheumatoid arthritis, and gouty arthritis. Osteoarthritis, also known as OA, is the most common chronic arthritis. OA is most prevalent in age and is probably related to the normal aging process. More women than men are affected by OA. In a healthy individual, this damaged cartilage is eventually replaced, but in people with OA, more cartilage is being destroyed than replaced. Now, rheumatoid arthritis, also known as RA, is a chronic inflammatory disorder with an insidious onset. While not as common as OA, RA causes disabilities in millions. It occurs in more than 1% of Americans. Some individuals may go to therapy or may just replace their joints. Indeed, some people that have RA suffer over a dozen of artificial joints. Now, gouty arthritis is pain and inflammation occurs when too much uric acid crystallizes and disposes in the joints. Gout is far more common in men than in women because men have a higher blood level of uric acid. Untreated, it can be very destructive. The articulating bone ends fuse and immobilize the joints. Now into Lyme disease. Lyme disease is an inflammatory disease caused by bacteria transmitted by the bites of ticks that live on mice and deer. It often results in joint pain and arthritis, especially in the knees, and is characterized by skin rash, flu-like symptoms, and foggy thinking. If left untreated, neurological disorders and irregular heartbeats may be ensured.